Welcome back, everybody. Well, if you have been told that you have uterine fibroid tumors, you'll be happy to know that there is an outpatient surgery available that may help you, especially avoid an untimely hysterectomy. Well, Dr. Iqbal is here from Buffalo Vascular Care to talk about fibroids and something called pelvic congestion syndrome. Good morning. I was back at your office recently, and now you're visiting us here on AM Buffalo.
Good morning, Linda. How are you?
You do incredible work. Thank you very much. I'm interested in the fibroids because I myself had fibroids, and I had an operation called myomectomy, which was very complicated. But you can handle fibroids in a much easier way these days.
Yes, that's true. Fibroids are very common benign tumors. Mm-hmm. It's usually more common in African Americans and people of Asian background. They grow with hormonal changes during pregnancies, and they keep on growing until the woman hits menopause, and then they start to regress. Mm-hmm. Now, during the time that they're growing, they can cause symptoms.
Oh, yeah.
And symptoms could be anywhere from pain, heavy bleeding, difficulty in conception, etc. Mm-hmm. So that's the background. The treatment usually involves hormonal manipulation. Next level of invasiveness would be to do a procedure called uterine fibroid embolization, where you basically choke off the blood supply to the tumors without surgery. And the most radical approach would be to perform a hysterectomy, meaning to remove the entire uterus.
So there are options, folks, and it's amazing to look into these things these days, because you may have been told years ago hysterectomy was the only outcome for you. Not true these days anymore. We're also going to talk about pelvic congestion syndrome and what that is and how that can be treated. And that's interesting in itself too, because you say a lot of women have been misdiagnosed throughout the years. Tell us what that is, pelvic congestion syndrome.
Indeed, it's a term that's usually given to pelvic pain, which is not diagnosed by a lot of physicians or through a lot of tests. It's a syndrome which involves congestion of veins inside the pelvis due to issues with valves, usually in the gonadal veins or the internal iliac veins. And as the day goes on, and since we are erect animals, right, the blood pools in the pelvis. And as the day progresses, people would feel more heavy in their pelvis, vague pain, and especially pain around intercourse that lasts after the intercourse, and the pain is not usually associated with menses. So that's the background for it, and it could be quite severe.
And how would you treat that?
Used to be that this was treated also by hysterectomy, where all the organs, including the veins, were taken out. Now it can be treated by blocking the incompetent veins and to sclerose the varicosities inside the pelvis.
Amazing. And I have to tell you, you have a super office. You're right there on Transit Road, and he has a surgery center right there. And the day I was there were patients already recovering and on their way out. It's amazing what you can do in an outpatient situation these days. But I have to tell you, Doctor, it's amazing. We want you to know that Buffalo Vascular Care is there for you when it comes to veins and issues like that, where there's pelvic congestion syndrome, things like fibroids. We would like you to get in touch if you have questions with Dr. Iqbal at Buffalo Vascular Care, again on Transit Road right there in Lancaster. So log on to learn more about what he does at BuffaloVascularCare.com, or give them a call right now and say 852-1977 is your number, 852-1977. You got nothing but great health ahead of you when you do.